Everyone, welcome and thank you for joining us today as we learn from Dr. Gina Serraiocco. Dr. Gina is dual board certified in internal medicine and integrative medicine and has been practicing at PAMP for the past 16 years. She loves meeting her patients at the intersection of Western and integrative medicine, as you will see in our talk today. She has worked closely with Dr. Karen Shin, board certified in OB-GYN at our Los Altos Center, to provide up-to-date information about a very important subject on all of our minds, boosting the immune system naturally in pregnancy during the upcoming cold, flu, and COVID-19 season. Dr. Shin will be joining us at the end of the Q&A, so be sure to send us your questions in the chat box throughout the webinar. Your questions will be seen by the moderator and asked at the end of the presentation. If you have a question that seems similar to those that you see in the Q&A box, you can like the question by clicking on the heart icon. And without further ado, we welcome Dr. Gina Serraiocco for her presentation.
Thank you very much, Stacy, for that beautiful introduction. I am excited to share what I've learned with you today, and I think what you're going to see is we're going to talk about how to make sure your immune system is nice and strong. And a lot of what we're going to talk about is just how to encourage a healthy pregnancy in general. So first, I have no disclosures, no conflicts of interest, and no affiliate marketing. That means nobody pays me for what I do here today. I'm just happy to share it with you. But if you do hear me mention any products, they are usually third-party tested or analyzed. So the Environmental Working Group is a great product safety website that you may want to know about. Anything you put on yourself gets into you and the baby. And any supplements that I recommend are third-party tested by consumerlab.com. They're looking for things like mercury, lead, quality, and value, and research. Now, just so you know, we're going to go through a lot of stuff. I will have a few summary slides towards the end with the supplements, suggested name brands, and dosages at the end. So those are the ones you might want to sort of mentally take a picture of. We're going into a really unprecedented time, cold, flu, and COVID season. The best defense is still a good offense. Lathering your hands for 20 seconds and rinsing, or using a hand sanitizer. Now, just my first sort of product recommendation is actually a really safe hand sanitizer called Everyone. It's unscented hand sanitizer spray. The reason why I went through this and looked for it is it only has 3 ingredients, and all 3 are safe in pregnancy. Whereas some other common brands have 9 different ingredients, and most of them I can't pronounce. So be aware of what you're putting on your body. Using a mask is additionally helpful, and a face shield might actually reduce your chance of you touching your face. The biggest thing I see people do wrong is they play around with their mask, and then they take their mask off, and then they touch their face. So don't contaminate yourself. Keep your hands washed, try not to touch your face. And social distancing outdoors is safer. Let me explain why, because I don't think this is really well understood by a lot of folks. Think about if somebody was smoking and then they put a mask on and then they exhaled. You know that the smoke would come outside of the mask. Those are called aerosols. We now know that COVID-19 travels in aerosols, except you can't see them. So the longer you're indoors with aerosols surrounded and not dissipating into the air, into the wide open outer space, we increase risk. So I don't say that to scare you, but just be aware to try to do your socializing outdoors if possible and spend limited time indoors. Also, when somebody has COVID, the most contagious time is in the 2 days prior to symptoms. So don't be falsely reassured by somebody looking healthy. And I don't say that, again, to scare you. It's just these are the facts, and it's good to know them. Now, how do we protect you? We're introducing here your antiviral military. This is your amazing immune system. You're going to hear me refer to things like the special ops team. The first 3 of these are the first on the scene. Natural killer cells, macrophages, neutrophils. The last 2, T cells and B cells, are kind of much more specialized, and they come in a few days later. We're going to want to learn how to optimize these without making them overreact. Crossfire, you're going to hear me say things like NLRP3 inflammasome, NF-kappa B, cytokines. These are the messengers of the immune system, and they ultimately can create a lot of inflammation. So again, we want enough inflammation to contain the intruder, but we don't want enough to cause a lot of damage in our body. And in COVID-19, this seems to be a major problem. There is an overreaction of the immune system. So when you hear me say that something is moderating or dampening or decreasing the crossfire, that's actually a good thing. And then we're looking at your immune system supplies, the nutrients, but also the antioxidants, and I'll refer to something called SPMs. These are kind of like neutralizing after the immune system has done its work. All right, we're definitely going to get into a lot of supplements, but first the foundation. No amount of supplements can neutralize an unhealthy lifestyle. So what's the research around your foundation, the 4 pillars, and immune system? Let's just jump in with exercise. I don't need to tell you that exercise is medicine, but pertaining to pregnancy, let's start out with a question. Regular, moderate exercise has been shown to decrease the common cold by 40%, decrease inflammation, the crossfire of NF-kappa B and cytokines, increase the incidence of a successful vaginal delivery, lower diabetes in mother and the offspring, improve learning and memory in the offspring, decrease anxiety in the offspring, or all of the above. Well, I probably wouldn't tell you these unless they were all true. So what's amazing is exercise is not only going to be good for your immune system, but it actually does a whole lot of great things for your pregnancy and for your baby after the baby is born. We call that an intergenerational effect. What you do now affects your baby after the baby is born in a pretty amazing way. So this study was just published last year, and basically what it shows us is on the x-axis is going to be your exercise, and on the y-axis is the infection risk, the risk of getting a cold. And what you'll see right in the middle is moderate exercise decreases the risk of a common cold by 40 to 50%. That's pretty amazing. If you go a little bit further on the line, we actually see that excessive heavy exercise actually increases your risk of a cold by 2 to 6-fold. So moderation really is the key. And that's maybe a power walk, 30 minutes, 5 days a week. You want to just be a little bit sweaty, but still able to converse. And women like to do power walking, swimming, spinning, and even prenatal yoga. So this is a nice segue into our next topic, which is stress. Most of us kind of feel like we're more likely to get a cold if we're under stress. And any of you who are used to having cold sores kind of know that as well. So then is it also true that reducing your stress might help the immune system? And in fact, that's exactly what a systemic review showed out of New York, which basically looked at multiple meditation research studies, and they were all consistent. A regular meditation practice decreases inflammation, decreases NF-kappa B, and improves your T cell, your special ops forces. As a side bonus, it also increases telomerase activity, which is a marker of longevity. Meditation's generally a good thing for you. We want to decrease your stress. So how do we do that? Well, my first question to you is, how do you feel after watching the news? Because if you're not feeling spectacular, this is the time to do some media distancing. There are so many support apps and classes that you can consider. Mindfulness-based stress reduction is something we have here at Sutter and most large medical groups, and a couple of really common apps that all have beginners buttons. You just need to commit to doing it 10 minutes a day. Prenatal yoga is also a wonderful way to relax, and these are some really free ones on YouTube. Sarah Beth Yoga, Yoga with Adrienne. The other great thing about relaxing your mind is that you sleep better. And why is that important? Well, this study came out of UCSF in 2015. And what they did is they took a bunch of volunteers, sleep deprived them, put a cold virus up their nose, and then looked at what happened. And what we found is that patients who slept less than 5 hours, 45% of them got a cold. Patients who slept over 7 hours, only 17% got a cold. So in fact, we know that when we get more sleep, we're less likely to get a cold. And this is just a diagram for the CDC, just emphasizing again, number one, when you don't sleep well, your natural killer cells, your first line of defense goes down. Number two, more inflammatory cytokines, more of that crossfire. And number three, your antibody production goes down. So we do want to emphasize good sleep. Melatonin is one part of that. Melatonin is the sleep hormone. It's made by the pineal gland, and it starts producing melatonin a little bit after the sun goes down. But it's actually a lot more than a sleep hormone. It actually is one of the most powerful antioxidants and anti-inflammatories in the body. This is just a diagramming depicting all the ways that it blocks and decreases the NLRP3 inflammasome, NF-kappa B, cytokines. It basically puts out the fire, which is a good thing when it comes to infections such as COVID-19. So just to summarize then, we want to really get good sleep, but we also want to optimize our melatonin levels. And we do that by getting a little sun exposure in the morning and the noon that sets our circadian rhythms, trying to minimize liquids at night, try to avoid the news at night. And pertaining to optimizing natural melatonin levels, this is really about making sure we try to minimize blue light in our electronics and the lights around us. The blue light is what shuts off the pineal gland production of melatonin. If you really can't do that, just the other day, I bought these blue light blocker glasses off of Amazon for about $20. They're comfortable. If you're really disciplined, you can put these on around 8 or 9 o'clock and wear them until you go to bed. These will pretty effectively also block out the blue light and hopefully help you to maintain your natural melatonin production. How about melatonin supplements in pregnancy? Unfortunately, there's just not enough data for that. I do recommend it for immune system in non-pregnant adults, and I get into that in another webinar, but in pregnancy, I do not recommend melatonin supplementation as there's just not enough studies on this. All right, the next pillar is going to be food. Let's not make it complicated. If it's grown in a garden or on a farm, it's good for you. So in a previous webinar that I did called Optimizing Your Immune System Against COVID-19 back in May, I actually showed a lot of research as to why these particular things in my antiviral smoothie prescription actually are antiviral and possibly anti-COVID specifically. Nature is medicine. Plants are medicine. So drink your medicine. 3 cups of veggies, citrus with the peel, green tea, berries, oats, seeds, ginger, banana, coconut, nuts. This is a really high potency set of nutrients that you actually can't get in supplements. So food is medicine. All right, aside from getting your supplies through food, do we have an additional issue? Well, this was really interesting, published in the Journal of the American Medical Association in 2019. A significant number of pregnant women are not meeting recommendations for vitamins A, B6, C, D, E, K, as well as folate, choline, iron, calcium, potassium, magnesium, and zinc, even with the use of dietary supplements. Even with your prenatal vitamin, a significant number of women are not meeting recommendations. Well, that's fine, Gina, but this is an immune system talk, so why is that important? Well, just this year, Nutrients Journal says a wealth of mechanistic and clinical data show that vitamins, including vitamins A, B6, B12, C, D, E, and folate, trace elements like zinc, iron, selenium, magnesium, copper, and omega-3 fatty acids play important roles in the immune system. Do you see the problem here? There is a lot of overlap with what pregnant women are deficient in and what's important for the immune system. So if we want to boost your immune system, we got to get you the right nutrients. So let's start talking about vitamin D. Vitamin D and viral infection. What do we know about that already? Well, in 2017, the British Medical Journal had a very thorough review of 25 medical studies, basically saying that vitamin D supplementation is safe and it protects against acute respiratory tract infections overall. So we kind of have our answer. Vitamin D is important for your immune system. Well, how about against COVID? This study came out last month, basically showing that if your vitamin D level, so x-axis is vitamin D level, y-axis is number of patients, and the dark line is COVID positive test. If your vitamin D level is less than 20, you were over twice as likely to test positive for COVID-19. Now, association is not necessarily causation, so we can't necessarily say that giving vitamin D is going to fix and protect you from COVID-19, but we already have enough research that it does protect against the common cold. So which of the following are true about vitamin D in addition to what I just told you? The World Health Organization. Vitamin D supplementation and status may reduce the risk of preeclampsia, low birth weight, and preterm birth. Diabetes Journal. The odds of type 1 diabetes was more than twofold higher for the offspring of women with the lowest levels of vitamin D. Lancet, which is another well-regarded journal, vitamin D supplementation of pregnant women could lead to long-lasting reductions in the risk of osteoporotic fracture in your offspring. And two different journals say 4,000 units of vitamin D daily to get a level over 30, the risk of asthma in your child is almost cut in half. All of these are true, and once again, we see the intergenerational effects. Getting enough vitamin D not only helps you with a healthier pregnancy, but it may decrease autoimmune disease in your child, decrease fractures, and decrease asthma. So what's the bottom line here? The RDA up at the right, upper right corner is the recommended daily allowance. TUL is tolerated upper limit. So this is set by the NIH, the National Institutes of Health. I'm going to be talking about the ODA, the optimal daily allowance. Optimal is different from normal. And I'm going to tell you to do whatever gets your level above 30 nanograms per milliliter, and your doctor can check this. How do we get it naturally? Well, you can get it from the sun, but in the winter, you'd have to stand out practically naked in the midday for at least an hour. That's a little bit unlikely. The second thing I'm going to recommend is Carlson Kids Norwegian Cod Liver Oil. Now, let me just digress for a second here. I'm mentioning a very specific brand because it's a brand that's been third-party tested to say what it has, and that includes vitamin A. I'm going to get into vitamin A a little bit later, and you'll see why. But for cod liver oil, I cannot just mention it generically. I need to give you a specific trusted brand. So salmon is the next highest source, but there's actually a really big difference between wild salmon and farm salmon. There's over 5x difference in vitamin D, and most people aren't eating a couple servings of salmon every single day. So the reality is we got to know what your vitamin D level is and just get it over 30. I give a recommendation here. If your level is less than 20, take 4,000 units a day. If it's between 20 to 30, take 2,000, and over 30, take 1,000. That's the RDA in pregnancy. Now, I've been here for about 16 years, and I will tell you about 80% of my pregnant women will test with a level lower than 30. So I feel pretty comfortable saying until you're able to get a test, or if you don't feel like coming in to get a test, 2,000 units a day would be a very safe thing for the average pregnant woman. And we saw in the research studies that women commonly got 4,000 units a day, and it was safe and fine. So you can get this in a good quality prenatal vitamin, and at the end I will give you a recommendation for my preferred prenatal vitamin, plus 2 teaspoons of Carlson Kids Norwegian Cod Liver Oil. That has about 800 units of vitamin D. Okay, moving on to zinc. Zinc and the immune system. So what do we know? The Cochrane Review is the gold standard of systematic reviews. So what they said in 2013 is zinc lozenges administered within 24 hours of onset of symptoms reduces the duration of the cold at a dose of 75 milligrams per day and use at this dose throughout the cold. So notice that they say zinc lozenges. First of all, most of the studies done on zinc and colds are done on lozenges. And the theory there is that we know that zinc can actually block the virus from entering the cell. So let's just say someone sneezed on you and it's trying to replicate in your throat. The theory is that if you suck on a zinc lozenge for a while, that it might give you an additional bonus against that virus. Now, oral zinc is probably just as fine, but not as many studies have been done on it. Also, the World Health Organization notes that zinc deficiency is responsible for 16% of all deep respiratory infections worldwide. A preprint article in Spain just noticed that there's a correlation between low serum zinc levels and poorer COVID-19 outcome. Again, we don't really know what to do with that information, but at least we have some evidence already that zinc levels are important in fighting a virus, or at least a cold. And then the bonus is that zinc supplementation has been found to decrease preterm birth by 14%. So in any case, it's important for your pregnancy. So the call to action here is that, in my opinion, an optimal daily allowance is somewhere about 30 milligrams a day. And you can find that in a good quality prenatal vitamin, plus a healthy diet, plus a zinc lozenge at the end of the day. Now, at the bottom right, you'll see that the most amount of zinc is actually in animal products. If you're trying to get adequate zinc levels as a vegetarian, it's going to be very difficult to achieve 30 milligrams. You would have to eat 5 cups of baked beans every day. So I'll review a specific brand of prenatal and zinc lozenges that you can use to get to this optimal dose. Now, as a side note, you might have heard of something called quercetin. Quercetin is a bioflavonoid found in healthy foods like onions, apples, raspberries, grapes, and it's known as a zinc ionophore. That means it helps zinc to get into the cell. It helps zinc to be more effective. So this is just another reason to eat a colorful, healthy diet with lots of onions and apples. All right. What do we know about vitamin C? Vitamin C is probably the most well-known supplement taken for a cold, but I find that people are either vitamin C lovers or vitamin C questioners. So let's look at the data. Another Cochrane review, gold standard in medical research. Given the consistent effect of vitamin C on the duration and severity of colds and the low cost and safety, it may be worthwhile for common cold patients to test on an individual basis whether therapeutic vitamin C is beneficial for them. Now, another interesting factoid that came out of this same review was that 1,000 milligrams of vitamin C daily during times of high physical stress decreases colds by 50%. So if you're training for a marathon, not when you're pregnant, or you're skiing or doing something that is highly physically intensive, actually high-dose vitamin C has been shown to really decrease the risk of a cold. So why is vitamin C helpful? Well, there's a few different things. We do have research to show that it does modulate your special ops to be more effective. It does decrease the crossfire, the inflammation. It's an antihistamine, but most importantly, it's an antioxidant. Now, my favorite analogy for vitamin C in a cold is kind of like this. Let's just say you have a campfire every night. You have a campfire and you have a certain amount of water, and every night you're able to put out the campfire with your bucket of water. That's like your normal vitamin C that you eat on a daily basis. But what happens if that campfire all of a sudden becomes a forest fire? All of a sudden that bucket of water is not going to do anything. You're going to need a lot more water really quickly and frequently. So on a research level, back in 1973, there was a researcher that looked at what happened to vitamin C levels in your body and in your cells within 24 hours of an infection, and it showed that vitamin C levels just plummet because it's being used so quickly. And he predicted that we need about 6,000 units a day during infections to maintain a normal level of this antioxidant. So the very prestigious Cleveland Clinic right now is taking that to heart and doing a research study in COVID. For COVID positive patients, outpatients, non-pregnant, they're giving a very high dosage, 8,000 milligrams divided into 4 times a day plus zinc. So those results are going to be out next year. But I have seen, just as an outpatient doctor, that my patients who take high doses of vitamin C at the first sign of infection, including COVID, seem to fare much better. That's about 2,000 milligrams every 6 hours. But what's safe in pregnancy? What's studied? Let's take a look. So most women probably don't need a whole lot of extra vitamin C on a normal daily basis. You have what's in a good quality prenatal vitamin, plus you're hopefully eating some oranges and bell peppers and broccoli on an average day. The real importance in vitamin C is to take a higher dose and frequently when you are ill, 500 to 1,000 milligrams every 6 hours. Now, 500 milligrams every 6 hours takes you to 2,000 milligrams a day, which is the tolerated upper limit. However, as we just saw, when you're infected, your levels plummet. So I feel like it's safe to take a little extra more during the infection and then go back to just your prenatal after that. Let's talk about vitamin A, another key ingredient that was short in supply but important for the immune system that we talked about earlier. So vitamin A mostly comes as beta carotene and is converted by a couple of enzymes into the active form called retinol. Beta carotene is called provitamin A. It's found in the leafy greens and yellow and orange fruits and vegetables, and you really cannot overdose on beta carotene. Retinol, the active form that your body actually needs for the immune system, is basically found in liver, and a very high dose, toxic doses, are associated with birth defects. Now, why am I distinguishing between the two? It's actually because about 45% of the women watching here have a genetic variant that decreases the conversion of beta carotene to retinol. So, and sometimes up to 70%. So I like to make sure that you get a healthy amount of beta carotene through normal foods like sweet potatoes, spinach, and carrots. If you happen to be a beef liver lover, this is the time to cut back to just once a week and just 3 ounces. But the optimal daily allowance is going to be a prenatal that has a combination of a beta carotene and the retinol forms. And this is just in case you're one of those 45% that doesn't convert it well. And we're going to add on for your immune system those same 2 teaspoons of Carlson Kids Norwegian cod liver oil. Now, in this 2 teaspoons, there's only 500 micrograms of retinol equivalents. That is about 1/5 of the tolerated upper limit. So you're not even getting close to being toxic as long as you stick to the 2 teaspoons a day. Okay. What about omega-3s? So omega-3s have data, this is found in fish oil, that it helps with the special ops. It helps to mitigate the crossfire. But more importantly, omega-3s are the precursor for SPMs, special pro-resolving mediators. SPMs are kind of like the calm down and cleanup crew after an infection. And you remember when I said some people in COVID-19 tend to have a problem where they end up in the hospital because the crossfire is just too much? Part of their problem is that they may not have enough SPMs to calm the infection down. So I like a nice high dosage of omega-3s, especially during the pandemic. And then as a bonus, it kind of naturally thins the blood a little bit without generally causing problems. And this is important in COVID-19. COVID-19 is notorious for causing the blood to thicken and clot, and omega-3s may be a little naturally protective against that. So what's the bonus? The bonus with omega-3s, not only does it help your immune system, but a study in 2018 showed that actually you may get a smarter baby. What it showed is that the higher level of your DHA in the bloodstream, your infant has better problem-solving skills. Isn't that interesting? Turns out that DHA is really important for the infant brain. The Cochrane Review in 2018 also noticed that women who are on omega-3s during pregnancy have decreased preterm births and early preterm births. So lots of reasons to take omega-3 even outside of just the immune system benefits. So my optimal daily allowance is over 2,000 milligrams a day, and that's going to be in a good quality prenatal plus those same 2 teaspoons of the Carlson Kids Norwegian cod liver oil. Now, we see a lot of benefits with that cod liver oil, right? We got our full dose of omega-3s, we got a very conservative, safe amount of vitamin A, and we have a little bit of vitamin D bonus. You can get it through food, but just be aware that vegetarian sources come in a form of omega-3 called alpha-linolenic acid. Only 10% of this converts to active DHA. So it's really hard to get your 2,000 milligrams a day just from food. Salmon, sardines, herring, mackerel, these are low mercury fish that are oily that do have a fair amount, 1,200 milligrams a day, but still not the 2,000 on an average daily basis during your entire pregnancy. All right, B vitamins and the immune system. We're not going to go into too much detail here. This graphic just basically shows all the different ways that different B vitamins are important in your immune system. And you can get this through a generally diverse farm and garden diet. B12 does need to come from animal products, so if you're vegan, we do need to supplement that extra. But when I talk about supplements, rather than changing the RDA recommendation, I'm actually going to be focusing on the optimal version of what's in your vitamin. So I'm going to demonstrate this through folic acid, B9. If you look at the top, the blue, 99% of the vitamins out there come in folic acid, and then you have dietary folate in foods. That needs to be converted by your body through 4 separate steps before it becomes the active one in green, 5-methyl tetrahydrofolate. That's what your body actually needs and uses for every single cell in your body. The problem is about 40% of the population has a mutation that decreases this enzyme by about 40 to 70%. So we're not getting all of the active folic acid in the body. So I'm going to recommend the RDA, which is 600 microgram, but I'm going to recommend for you a prenatal vitamin that has it in the L-methylfolate form. B12 is the same story. 99% of the vitamins have cyanocobalamin, but the active form is methylcobalamin and adenosylcobalamin. So I'm going to recommend the RDA, but I'm going to recommend that your multivitamin, your prenatal, have methylcobalamin, and I have one in mind for you at the end. Same story with B6. We're often given the pre-form, and your body has to convert it to pyridoxal 5-phosphate. Now, some of you might recognize this as being important in morning sickness and nausea because a very common prescription called diclegis or Bonjesta is actually a combination of doxylamine, which is an antihistamine, and pyridoxine, which then needs to be converted to P5P. In my practice, I've noticed that if I just give women the high dose of P5P directly, the active form, they oftentimes do just fine with their nausea without necessarily needing to go on to prescriptions. So I'll give you a specific recommendation for that towards the end. All right, so the call to action around B vitamins, really just eat your healthy farm and garden diet and you'll get enough, but I'm going to recommend a prenatal that has the active forms of these Bs just to make sure that you're getting the full amount, even if you don't know what your genetic panel is. Let's take a moment and talk about probiotics. Which of the following are true? A, they are linked with a decreased common cold frequency and duration. B, they're proven to be safe in pregnancy and postpartum and in infants with the bonus effects of decreased gestational diabetes, decreased postpartum depression, decreased neuropsychiatric disorders in the offspring, decreased eczema in the offspring, or all of the above. Of course, it's all of the above. Probiotics in pregnancy and postpartum and with the infants has been shown to decrease things like autism, depression, anxiety in your offspring. So I generally do recommend probiotics on top of a diverse diet, even if you're eating sauerkraut and yogurt and kefir. Okay, so we talked about a number of vitamins earlier, but always on top of a strong foundation, right? Supplements cannot replace a strong foundation. So we saw this slide earlier. We see that women, even with a prenatal vitamin, are missing a lot of nutrients in pregnancy. And these are the same nutrients that are important for the immune system. So let's put it all together. But before I give you specific vitamins, I'm going to give you the standard disclaimer, which is the recommendations here are considered generally safe for healthy pregnant individuals. But if you're on medications or have liver or kidney disease or any medical issues, please review this with your doctor before making changes. And again, when I tell you about a specific brand, it's generally been third-party tested for safety. supplements are not generally regulated, so it's helpful when a third party can say it's free of mercury and lead and it has what it says it has without contaminants. And I'm generally choosing one that's the best bang for your buck, okay? So, is there such thing as the best prenatal vitamin, not only for your immune system, but also just for your pregnancy in general? Honestly, it took me 5 years of additional medical training through my integrative medicine fellowship, nutritional and functional medicine training to be able to read a multivitamin label with confidence. This is not something that they teach us in medical school. So I did look at over 15 different brands critically with my lens. And there's no such thing as a bad prenatal, by the way. So whatever you're taking, feel good about it. But I'm just sharing what I would take if I was pregnant. And that is Smarty Pants prenatal vitamins. So this comes in a capsule on the left and gummies on the right. What's different about this vitamin? And again, whatever you're taking now is fine, but I do think this has particular qualities above and beyond many other vitamins. First of all, in case you're that 45% with a defect of converting beta carotene into retinol, 50% of the vitamin A here is in the retinol form. It has a good amount of vitamin C, so together with a healthy diet, you really don't need to take extra vitamin C on an average daily basis. It's got a good baseline 1,000 milligrams, 1,000 units of vitamin D. It's got the vitamin E and vitamin K that are important for both replacing nutritional deficiency, but also for the immune system. Those B vitamins are in the methylated form, methylated folic acid, methylated B12, and you have your pyridoxine 5-phosphate. It's got a small amount of zinc, just a small amount. It's got a tiny amount of omega-3. It's got some good amount of iodine, but not too much choline. No calcium or magnesium, so we'll address that separately, and no iron in the gummy form. But overall, after comparing at least 15 different over-the-counter and prescription multivitamins, this is the one that I would take, and this is the one that I recommend to my patients. Now, that's not enough, right? We saw a study saying that even with a basic prenatal, women are still deficient. So the next couple slides are just filling in to what I think is optimal on a good foundation. So the multivitamin we talked about, cod liver oil. Remember, cod liver oil gives those 2,000 milligrams of omega-3s. It gently boosts your vitamin A, D, and E for your immune system. And we're taking 2 teaspoons of this specific brand, Carlson Kids Norwegian cod liver oil. And again, I say that because it's third-party tested for its amount of vitamin A. We are nowhere near toxic, okay? Now, if you really just don't want to do the cod liver oil thing, then at least take Nordic Naturals prenatal DHA or algae omega if you're vegetarian. This is going to miss those extra vitamins, but at least you're getting your omegas. And we saw the potent reasons for taking a probiotic, and one good brand is Garden of Life doctor formulated prenatal probiotic. That's your basics. If you do nothing else, you might want to just start with that. But in addition, on the foundation, we talked about the importance of getting your vitamin D level over 30. So there's some in your prenatal, right? Smarty Pants has 1,000 plus 800 in the 2 teaspoons of cod liver oil. But if your baseline vitamin D level is less than 20, you're going to need an additional 2,000 units. How about that zinc lozenge? I like Life Extension Enhanced Zinc Lozenge. It's actually made with zinc acetate rather than zinc gluconate. And some biochemists feel like the acetate helps to release the zinc much better than the zinc gluconate, although the gluconate is fine. A lot of studies have been done on that. You might want to consider taking this nightly. So after a theoretical exposure, if you are teaching or if you're working, if you had an exposure, if we're going to take extra zinc, consider taking it at the end of the day where it's theoretically coating the back of your throat and maybe giving you additional benefits above and beyond just the zinc itself. And then vitamin C. Remember, vitamin C with your prenatal vitamin and a healthy diet, you really don't need extra on an average day. The key is to have some extra around at the first sign of getting sick. So the first sign of getting sick is when your vitamin C levels plummet, and that's when you need to replace it, okay? Number 3, this is going to fill in a lot of the gaps that we didn't have time to talk about today, but are just as important. So let me go through them one at a time. Iron. The RDA for pregnancy for iron is 27 milligrams. You would have to eat 3 cups of white beans every day, or 9 servings of beef and chicken every day to get the RDA. Most women are not even getting near that. So there is a brand called Now Iron with 18 milligrams that I would recommend for all women once daily when pregnant. Now, if you're anemic and you'll work with your doctor on this, you may need to take it 2 or 3 times a day. Next, calcium and magnesium. Now, I am an integrative doctor, but I'm also an internist. So I see a lot of mommies after they give birth, and years later, we see osteoporosis. Part of the reason is because your baby is going to take that calcium one way or another. So we need to make sure we supply you with enough so it doesn't come out from your bones. Now, even if you're eating dairy, you're probably still not getting enough for the RDA unless you're eating about 3 servings a day. If you're vegetarian or vegan or not a big dairy lover, I would recommend Solaray CalMag citrate 2-to-1 ratio, that specific ratio, because it has the magnesium. Magnesium is supremely important not only for your entire body, but your bones, but also for activating that vitamin D. So I'm going to recommend 2 capsules a day if you're eating at least 1 serving of dairy, and 4 capsules a day if you're not a dairy eater. That's going to take you still to only about 2/3 of the RDA, okay? And then choline is something that nobody talks about. You cannot make a nervous system and you cannot make a brain without choline. And it was one of those things that was deficient both in the JAMA article and in the nutrients article. So choline does come from various foods, but look, the RDA is 450 milligrams in pregnancy. You would have to eat 6 pieces of chicken every day to get enough choline. You'd have to eat 10 cups of broccoli every day to get enough choline. Most people really don't get enough choline according to the research in pregnancy. So definitely if you're vegetarian, but even if you're not, I would recommend taking supplemental choline. Most prenatal vitamins will have a tiny amount, less than 50 milligrams, but you see here that the tolerated upper limit in pregnancy is 3,000. So it does not hurt to take a choline supplement just to ensure the development of the neurological system to complement what you're eating. All right. And then last thing, I mentioned the P5P for morning sickness or nausea. You can find this by Source Naturals, the 25 milligrams 4 times a day. Only take that if you have morning sickness and see if it helps you. If it does not help you, stop it and then talk with your doctor about a prescription to get some extra help. Okay, so most of you are healthy women watching, and you're probably just shocked at the number of supplements I just talked about. But I hope you saw the rationale behind them. Studies showing deficiency, studies showing what it takes to replace them. So I might recommend using a healthy pill box, and in the morning taking your Smarty Pants, iron, choline, and probiotic with your first meal. And then with dinner, I specifically put the CalMag cod liver oil and D together. They are synergistic and best absorbed with a big meal. And then maybe taking that lozenge at the end of the day. Now, we have a couple minutes left, so I'm going to take a dip into Mother Earth's medicine chest because herbals are certainly on people's minds during cold season. So what about echinacea, one of the most popular herbs in the winter? Echinacea is an antiviral, antioxidant, anti-inflammatory. There's limited research. It's likely safe in pregnancy, okay to use sporadically, but not every day. To me, the bigger issue with echinacea is it's usually combined with a bunch of other stuff, and that other stuff hasn't been tested in pregnancy. So if you've used echinacea in the past and you want to use it for cold, get a pure product like Nature's Way Echinacea that only has echinacea in it, and you can use 400 milligrams every 8 hours just around your cold. What about spices? So ginger, and I refer to ginger because of people using it for morning sickness and nausea. What's likely safe is a 1-inch ginger root or 1 strong bag of ginger tea per day. That's going to be about 1,000 milligrams. Traditional medicinals, organic ginger tea is what I recommend. They are sort of like an apothecary brand, and I would use that 1 bag all day. So I'm a little concerned about the women who use 5 bags in a day trying to help their nausea. Too much ginger can actually perpetuate nausea. With turmeric, turmeric is such a wonderful anti-inflammatory for so many things, but it just hasn't been studied in supplement form. But what's used in regular cooking, 1 to 2 teaspoons a day, is certainly safe. Turmeric golden milk is one of my favorite recipes or go-tos for sore throats and colds. So this is something to keep in mind. And golden milk is not actually made with dairy. It's usually made with coconut milk and almond milk. You throw a few spices in there. Great for soothing a sore throat, great for your immune system. And you can easily look that recipe up by Googling it. Another favorite natural recipe of mine is thyme cough syrup. And this is Dr. Tierna Lodog's recipe. She's one of the premier MD herbalists in the country. Thyme is actually a very safe supplement in pregnancy, and it helps to decrease some of the cough receptors. So this is much safer and much purer than a lot of the products that you find over the counter. Basically steep the thyme, add a little honey, and take a couple tablespoons every few hours. Couple of additional herbal notes that came up in my research. Peppermint tea is safe, but some people don't realize that peppermint tea every day can actually make acid reflux worse. So if you have acid reflux, maybe skip the peppermint tea. This made me super sad. Chamomile tea. Chamomile tea on a daily basis has been associated with a higher risk of preterm delivery and low birth weight. Don't worry if you've been drinking it, but just reduce it. So it's okay once in a while, but just don't drink it every single day. And this made me sad as well. Elderberry is one of my favorite herbs to use, particularly against influenza. There is good research against influenza itself, but there is absolutely no data in pregnancy. I looked even for animal studies. There are actually no animal studies in pregnancy, so I just can't recommend it while you're pregnant. But keep it in mind for the flu after you give birth. And other herbs that are used commonly, Astragalus, Andrographis, Propolis. These ones actually had some small animal studies showing safety, but no human studies in pregnancy. So I wouldn't take them regularly, but in pregnant animals, it seems to be fine. So if you like to take them, kind of like with the echinacea, just around the cold, it's probably fine. All right, so we just went through a lot of stuff. And I hope that you are feeling empowered now, empowered to take this day and go forward. I hope you don't feel stressed out. Please don't stress out. If you feel like you missed out on any optimization, this is not a time for fear or self-criticism. You and your baby are going to be 100% fine, and you're going to be an amazing mother. But as with everything else in life, you can start from today with new information and see if you want to go forward with making any changes. So I wish you a vibrant and healthy journey with you and your baby. And I think we may have some time for questions. I did want to say that this recording is going to be posted on the PAMP Holistic and Integrative Medicine website. Sometimes it can be hard to find things there, so I will also post it on my very new Gina Serraiocco MD YouTube channel. So this should be available somehow on the internet in about a week if you want to watch it again or share it with any of your friends.
Thank you so much, Dr. Gina. I'd like to now introduce Dr. Karen Shin, OB-GYN, as she joins us for our Q&A session. Dr. Shin, how do you feel about the information Dr. Gina presented today? Do you have any additional comments or concerns?
No, it was wonderful, Dr. Serraiocco. Thank you for such a detailed and well-researched and helpful treasure trove of information. I think we all learned a whole bunch, so I really appreciate it.
Wonderful. Thanks, Dr. Shin. I'm going to begin reading questions from the audience. We're going to go through just a few before we introduce Dr. Lockhart to share some exciting information with us. So this is for Dr. Shin. Can you share with the audience, do you recommend the flu shot?
Yes, definitely. We recommend the flu shot in all trimesters of the pregnancy. We are actively offering this to all of our patients who come in at any time during the first trimester when breastfeeding. We think it's a great way to be prepared for flu season.
Okay, wonderful. And another question that came in for you, Dr. Shin, is it okay to do weightlifting in pregnancy?
Yes, with pregnancy, we prefer to have patients do what they were doing prior to pregnancy. It's not the best time to start a whole new fitness program, but if you were weightlifting safely before, I especially encourage that as part of your fitness in pregnancy.
Okay. Another question, this will direct to Dr. Gina. If a patient asked, if I eat a healthy diet, do I still need a supplement?
You know, I get this question a lot because as we kind of went through today, we ended up with kind of a handful of supplements, and we want to think about whether or not those are really necessary. I think in that JAMA 2019 article, it did say a significant number of women were still deficient, even with their diet, even with the prenatal vitamin. And there's a few different reasons for that. One reason is that our soils, actually our agricultural practices, have depleted a lot of nutrients from our soil. So studies have shown that a pile of broccoli, for example, now, if you compare it to 30 years ago, has a 20 to 30% reduction in vitamins. So we literally aren't getting as much as we used to. The second thing I think about is our gut microbiome, the microbiome of the gut, the bacteria in the gut. A healthy gut microbiome is actually needed to absorb a lot of the nutrients, particularly vitamin A, vitamin K, iron. And so given all the antibiotics use in our culture, it actually has wiped out a lot of the healthy gut microbiome that's responsible for absorbing things. It's actually one of the reasons people are B12 deficient. And then the third thing I would just add is the notion that our body uses nutrients in order to bind toxins that we're exposed to and get them out. So there are 80,000 chemicals approved for use in the US. These are things like exhaust, these are things like pesticides on our food, or the flame retardant that's on our clothes, etc. Our bodies are capable of getting that out, but they need the nutrients in food in order to do so. So if we're using it all up with those things, then we don't have enough left over for our body. So I do think that specifically in pregnancy, because not only is your body doing the baseline amount of stuff, but you're gestating a beautiful baby, that we do need to be a little bit more proactive about making sure you get all your nutrients.
That's a lot of important information to be aware of. Thank you. We have time for one last question before we invite Dr. Lockhart to join us. This one is going to be directed for Dr. Shin. Dr. Shin, can you tell us, are pregnant women more at risk for COVID-19?
So it's not real clear what the actual risk for pregnant women are. I think we've all seen some information from the CDC potentially saying that pregnant women are at risk for higher complications. What I can comment upon is, in my practice, we haven't really seen first of all, much COVID, which is great, and definitely not much in the way of severe complications. There has been a study out of UCSF called the Priority Study, where they collected a lot of data from pregnant women with COVID. And so far, the initial press release shows that there are definitely COVID in pregnancy. There are definitely lingering symptoms, but at least with the infants, things are reassuring. And I think we'll get more data as time goes on. So a very common question I get is, should I be getting pregnant in the time of COVID? And I think that I feel personally as an OB, it is okay to get pregnant. You'll do fine.
Okay, wonderful. Thank you. Thank you both, Dr. Gina and Dr. Shin. We really appreciate everything that you've shared with us today. And I just want to let the audience know, if you happened to have asked a question that wasn't answered today, to please check with your care provider to make sure you get the information that you need.